Painful intercourse is what many ladies go through, but they don't like to talk about it. It is very, very difficult for them to talk about it because they feel it is embarrassing. But my darling, you just need to talk about it. You need to get help because if you don't and you're just bottling up your emotion, the condition will remain the same or it will get worse. Disclaimer, I am not a doctor, I am not a gynecologist, I am a nurse. So that being said, let's talk about painful intercourse. Now, the reasons why you might be having painful intercourse, there are a variety of things that might be causing pain during sex. But we are going to talk about some of the reasons in this video. So the number one thing I'll be talking about is vaginal infection. A chronic vaginal infection, yeast infection, can cause irritation, and once there's irritation, there's probability for you to have pain during sex. Another reason why you might be having painful sex is vaginal dryness. Yes, if you are not properly aroused before going into sexual activity, there can be pain during sex. And in this case, you need to top up your foreplay game, or you used an approved water-based lubricant for lubrication. So psychological effects can also be one of the reasons why you are experiencing pain during sexual intercourse. In terms of psychological, there are some ladies that they are already anticipating pain during sex, and because of that, they tighten their vagina. And definitely when you tighten your vagina, there is possibility for you to feel pain when you are having sexual intercourse. Now, there are other reasons that you can talk about. Talk of uncomfortable sexual position. Probably you don't enjoy a particular position. It can make you to tighten your vaginal floor and it will result into pain. There are other conditions that we can talk about, such as vaginismus. So vaginismus simply means the tightening of the pelvic floor muscles. So the pelvic floor muscles, if they are tightened, there is no way you can enjoy sexual intercourse. By now, I'm sure you should all know the difference between vagina and the vulva. This one you're seeing outside, it is not the vagina. That is not the vagina. The vagina is inside. You can't see it with your eyes except if it is being checked through ultrasound or any machine that you use to check it. And the vulva is the one you are seeing outside, which is not, that is not just all. You in the vulva you have other sectors like the clitoris, like the labia minora and labia majora, and other parts of it. So vagina can also be one of the reasons why you might be experiencing painful intercourse. Vulvodynia simply means there is pain at the vulva as a result of what sensitivity to the nerves present in the vulva. So all these conditions that I have mentioned, you cannot base your diagnosis on this that I have said or any other information that you're seeing online unless you visit your gynecologist. So the best thing for you to do is to visit your gynecologist, get assessed properly. History will be taken for them to know which one you're suffering from, because if it is the vulva now, it means it is just before the penetration. But if it has to do with deep penetration, then you cannot be talking about other pelvic organs, maybe like the uterus or like the ovaries. So this is why you need to go for checkup, for assessment with your gynecologist. By doing this, you'll be able to know which one is the cause of your painful sex. Everyone deserves to have a pleasurable sexual intercourse. No one deserves to have pain during sex. The worst thing for you to do now is just to sit at home and do nothing and make the condition worse. There's nothing to be embarrassed about. There's nothing to be shy about, my darling. We healthcare professionals, we have this thing in us that makes us to support people we care for. We support you, we won't judge you. So feel free to walk in to see your gynecologist and get checked up today. So my darling, make sure you visit your gynecologist. Okay, bye.